Ladies and gentlemen, good morning, good evening, good afternoon. Welcome aboard the Max Afterburner podcast, sponsored, brought to you by the No Fallen Heroes Network. Have an in-studio guest, man. This doesn't happen too often. It needs to happen more often. But Dr. Jonathan Fields, DAOM. I actually had to look this up. Doctor of Acupuncture and Oriental Medicine.
You got it.
Nailed it. First try. Is a renowned integrative specialist, author, martial arts instructor, keynote speaker, artist, and plant medicine advocate. Man, you're hitting all the wickets right here. Owns multiple clinics down here in South Florida. He specializes in functional medicine, acupuncture, mental health, psychedelics, and longevity. Man, it doesn't get any better than this. He's lectured at universities, Fortune 500 companies, works with elite pro athletes, celebrities, hosts, transformational retreats, which is where I met Doc, formulated for public companies, lived with monks in the Shaolin Temple. Now, did you walk on the rice paper and leave no trace?
We did not walk on rice.
Oh, man.
We had lots of other fun, though. I can tell you some stories.
If you grab the pebble from my hand, you know.
Exactly.
Yeah. I'm old enough to remember that. He writes for the American Journal of,
Endocannabinoid Medicine.
That. And petitioned the DEA to reschedule psilocybin. My brother. Let's go. He's the CMO, Chief Medical Officer at NeuPath Mind Wellness. It's a ketamine-assisted therapy and community integration center in Delray Beach, which is, and we're going to get to that, obviously, my brother, because that is helping save and change lives. So give us a quick background, man. How do you go? Now, you gave me your background. We'll talk about our Malibu retreat in a little bit. How'd you go from a kid to sitting here today with all of that stuff?
Well, it was a great intro, and I got to live up to it, I
exactly.
guess, right? But I appreciate you having me on the show, Whiz. It's a great question, you know. So I was actually born in Israel. I moved over here when I was 7. My father was born and raised in Miami Beach, actually. And, you know, we came over here, and I think I mentioned this to you, you know, as a kid, I wanted to be a, Rambo like you, right? Yeah. And as I got a little older, actually, when I got into middle school, high school, or actually early high school, I got introduced to psychedelics. And, you know, for then, at the time, it was just for fun, for partying, experimenting. Although I did think it helped me with some of the culture shock that I had leaving, moving from a different country, learning a new language, assimilating over here. I think there was some depression, leaving my whole family behind. You know, my folks, my brothers came here, but all my aunts, uncles, cousins, everybody's still over there. And I was born on a farm in a little village, on a sheep farm. So coming over here to the suburbs, it was a big culture shock.
Culture, yeah.
Yeah. So, growing into it, I think that kind of helped me find myself, and that got me more into, art and music and that path. And I delved into that for a long time. And then I got introduced through my martial arts practice. I've been in martial arts most of my life. Mm-hmm. And I guess about 20 years ago, my Qigong master is an acupuncturist, and he started treating me every time I got injured with acupuncture. Mm-hmm. And it was very effective for musculoskeletal stuff. If, you pulled a muscle or, your neck was out of whack, it always worked well. I had good results with it, and I just got fascinated. And then the Qigong, which is like a Tai Chi practice, and you did some of it with us over at the retreat, the effects were so profound for me. Like, you could feel the differences, much like how people describe and how you describe your yoga practice, right?
Correct.
It changes your life, right? Mm-hmm. And you start to adapt and really become a different person and open up. So I got more and more into the Eastern medicine through that. And I spent about 10 years interning with him and studying with him and teaching his seminars and learning more and more. And then about 13, 14 years ago, I was about 30, 31 at the time, I got chronically ill. I got really, really sick. And for about a whole year, I just got worse and worse. And I was having hot flashes and chills and fatigue, severe depression. I could barely get out of bed for more than a couple hours. I had systemic joint pain, every joint, my whole entire body. Mm-hmm. My neck and back were so bad, I physically could not sit in a chair for 5 minutes because it was just too painful. Ooh. And I had tendonitis and bilateral carpal tunnel that they wanted to operate on both hands. And I'd wake up with my hands burning numb and have to shake them out. I could barely shake your hand or lift a glass of water at one point. And I spent a whole year going from doctor to doctor to doctor. And I saw 3 different neurologists and 2 different hand surgeons and orthopedic and my primaries and endocrinologists. And they were doing biopsies on my thyroid. Yeah. And all I got back was, it's all in your head. and all your numbers are fine. And here's some muscle relaxers and here's some pain pills.
Wow.
Yeah. And I knew better than that. I had, like I said, messed around in high school, and I've probably had about maybe 30 friends so far since I've graduated high school that we've lost to the opioid epidemic, and family members and the whole nine that have gone through it. So I knew to stay away from that, but I still wasn't getting any help.
Yeah.
And I walked into a friend of mine's vitamin store one day, a guy by the name of Reed Eckert. He's a formulary. He actually invents vitamins. And the first thing he said to me is, "You look like crap." So I said, thanks. Right, exactly. So I told him my whole story, and he tells me, "I know exactly what's wrong with you. I'm going to get you better." And I'm thinking, bullshit, right? I've already seen all these doctors.
And
I'm a specialist. I'm like, you sell vitamins, and and you're here in a t-shirt and shorts and
exactly.
behind a retail counter. What are you going to do for me? But I had nothing to lose at that point.
Sure.
So I gave it a shot, and it was a miracle. I mean, within 2 weeks, the hot flashes, the chills, the fatigue, and depression were completely gone. Right? He gave me some different nutrients. He had me change my diet. He introduced me to a chiropractor by the name of Paul Grillo, who helped me tremendously as well. And they started putting me back together. And within 6 to 8 months, all my pain was completely gone. And all my pain was gone. My energy was back. I was a whole new person. And I was living a pretty healthy lifestyle. I mean, I was exercising probably 2 hours a day. I
martial arts.
It's not like I had a bad lifestyle to begin with, but it just wasn't working for me. Right. Yeah. So I had made these changes, and that really opened up my eyes to the frustration of how terrible our medical system can be for chronic care. Now, if I have an emergency,
sure.
Right. Or you have an emergency. Don't call me. Right. I want the jaws of life. I want to be airlifted. I want, the best of the best, all that stuff. But when it comes to, daily autoimmune diseases, digestive issues, even just pain in general, right? We're doing the exact opposite of what makes sense half the time.
Oh my God.
So after that, it was almost like a calling from God. I had already been studying the acupuncture for, 10 plus years in the Eastern medicine. And I decided, hey, let's go back to school. Mm-hmm. And I went back and did a bachelor's in health sciences, a master's and a doctorate in acupuncture and Eastern medicine. Spent time, like we talked about, living with Shaolin monks for months at a time in China on multiple trips. And learned as much as what I could, opened a clinical practice, got involved with functional medicine, which is kind of, reading people's blood work, getting advanced testing and getting them the right nutrients and diet plans and, common sense stuff that's been around for thousands of years to work. And then over that time, the last, 7, 8, 9 years, I've kind of just been watching what's going on with the science on the psychedelic space, because mental health is one of my specialties. I do very well with it. I was also, I'm an alumni of the Parkland, high school where they had the incident over there a few years. Right. So I worked in the trauma center there for 2 years when they opened. I was doing acupuncture and teaching Tai Chi classes. I was teaching art classes there. I was just there a few months ago for the anniversary. Last month, actually, I do a Tai Chi class there for the Mind Body Club every year on the anniversary. So I've always been very interested in the space. And as you know, the options are kind of limited on the medical space. And I'm very good at what I do with the Eastern medicine and the acupuncture and the functional medicine. And that can probably solve probably 70, 80% of people's mental health issues. But then you got those, 20% or 30% or whatever it is that have severe issues or have severe, PTSD or something like that, where it's just not enough. A couple of needles and some vitamins and, a yoga class is not going to fix those kinds of problems. Correct. So I began looking at the research, and the research on all this stuff is overwhelmingly positive. And I thought, I had like my experiences as a kid, and I kind of left all that behind me. But then when you're looking at, these rates of success, they're 60%, 70% or higher in reversing anxiety or treatment-resistant depression. So we're talking about people who've already tried all the medications. They've tried everything, and they've had terrible side effects from them. Correct. And sometimes some of the side effects are suicidal ideations and things like that. Or
they give you something because you're depressed that might make you want to commit suicide.
Right.
It's insane.
Yeah, exactly. And then when you get the side effects, then they give you, sometimes the doctors will actually tell you those are not side effects, even though you can look them up. I mean, I have patients tell me this stuff all the time. Oh, my doctor says it's not a side effects. And I'm like, well, it's on the side of the bottle. It's right there. So it's, frustrated with that. I just try to see, what more was out there. And we're looking at the research on the psilocybin and the ketamine, and what's going on with MDMA, which is going up for August 11th, which will be, hopefully getting its getting rescheduled at that time, which is exciting. And now Ibogaine and some of these other compounds, I just thought, my patients and everybody deserves access to these things. A lot of these things have already passed clinical trials, right? So, or phase 1, phase 2, some of them even phase 3 clinical trials like MDMA, and they've been found to be safe and more effective than some of the other treatments that are out there, more effective than even a combination of the medications and psychotherapy and all these other things. We're finding that they're more effective. So I just don't see how it's possible. I think it's a huge disservice, and it's unethical and immoral to keep people that need help away from these medications that we know work.
Yeah, man. Unbelievable. So the results, whether it's from the MAPS phase 3 trial with MDMA or this week with Cybin, a synthetic 16 milligram dose, 4 months later, 75% remission in people suffering from major depressive disorder.
Nothing comes even close. There are no other medications. There's no type of therapy. There's no, deep brain stimulation. Nothing comes close to those kind of numbers.
Janssen or Johnson makes Spravato, 7 to 12% for PTS.
Right. And to be clear, that's the nasal ketamine. Right?
Yeah.
Right.
My God, man. We're talking not 7. I just said 75% with Cybin. And then last week, MindMed came out with a single dose of LSD. It was 48% remission after 12 weeks with GAD, generalized anxiety disorder.
Incredible.
You can't believe these numbers. I mean, but you and I both know that these medicines have been around for thousands and thousands of years. We're a little arrogant in the rest. Like we're like, hey, we just discovered this stuff.
Yeah,
and
totally.
Your background's like, wait, these guys have been using this for a couple thousand years, right? Ibogaine or, Iboga from Gabon. They're like, yeah, welcome to the party. Where you all been? So let's get into a little bit, because you and I met, a couple months ago out in Camp Zappy out in Malibu. Beautiful.
Malibu Hills, Agora Hills.
My God, man, what a beautiful, that was right out of Central Casting. That
for sure. Yeah. 50-acre private mountain, private creek on a property, right? 10-acre camp with a 40 acres on the mountain. Yeah. I mean, you couldn't get anything more
perfect
beautiful.
Weather.
Yeah.
I mean, it was just fantastic. And the reason I went was because I never sat with ketamine. And I'll be honest, I was a medicine snob. I thought that ketamine was, lab, coat and all sorts of stuff like that. And then I found out, I think it was you told, it's made with salts, and the way it's made kind of is not necessarily a plant medicine, but it's of the earth medicine.
It's made from natural compounds. Yes, it's a synthetic drug, but it is made from natural compounds. And I'm right there with you for a long time. Well, from growing up in the 90s here, and we had the whole rave scene and all that, I was kind of like anti-ketamine. And with all my experiences, I've been super anti-pharmaceutical. So at first, and being a trained herbalist, I'm always like, hey, let's go to the plant medicine first. You got ayahuasca, iboga, psilocybin, whatever it is, peyote, all these different things. And I was kind of closed off to ketamine. And even a couple of years ago, I was like, no, I'm totally against it. But I had a patient. I had a 21-year-old patient. It was the parents brought him in, and the kid was suicidal. I mean, bad. And severe anxiety, severe depression. Couldn't function, couldn't get through a day-to-day, in and out hospitals, tried every medication, tried every therapy. I tried the acupuncture. He couldn't really keep up with the routines, and it wasn't really viable for a young kid to keep coming in for treatments and keep it with all the integration. He just couldn't do it. So I referred him out to a friend's practice, to Dr. Michelle Weiner, to go do some ketamine with her, right? And with Sherry to do therapy there. And he did his 6 sessions, and it's been a couple of years now, and I'm still in contact with the parents, and the kid is on 0 medications. He goes to school, has a girlfriend, has a job, living a completely normal life. And I think he went and did 1 or 2 follow-ups from there, and that's it. But now he's medication free. So we kind of, saved him from a lifetime of these medications and suffering and feeling like a pariah to society, to having a perfectly normal life.
Or you saved his life. He might not be here.
100%.
Wow.
And I was, and the parents are still close with us, and like they get all teary eyed and crying. And we have kids at home too, so we understand what that's like. God forbid your child ever has to go through that, or a
you
family
feel helpless
member.
As a parent. My God.
And you rely on the doctors, and if they're not giving you good advice, or the kids are getting worse and worse, and then they just kind of throw their hands up in the air. It's they don't know what to do with it. So I think that was a big eye opener for me to see it firsthand, to know, you can read the studies, but when it's somebody and you've met and, shaken their hand and looked at parents in the eyes. Yeah, totally. I think it changes. And that's one of these things, like clinical experience versus research. Like the research is great because we need that to push policy, but I'm much more interested. I'm still hands-on with patients in the clinic. So
Correct.
I don't really care. Whatever works for the patient, I don't care what it is. Obviously, as long as it's safe, I'm all for it. It was that. And then I had talked to other doctors and people were telling me, explain to me how it comes from, different organic compounds and the safety record. That's also what kind of pulled me through, because I was thinking, pharmaceuticals, overdoses. We just saw what happened with, the Friend Star.
Matthew Perry. Yeah.
Exactly. So when it comes to ketamine in a clinical setting for mental health at these dosages, there was a meta-analysis done. There has never been one single death ever of ketamine at these dosages in a mental health setting. Right now, if you're doing anesthesia, you're talking about 10 to 15 times the dosage.
Yeah.
It's
Matthew
still
Perry 10 to 15 times. I mean, the guy,
he put himself in anesthesia in a hot tub. I mean, you could have done open heart surgery on the guy and he would have woken up from that. So, recreationally, sure, there's a potential for abuse. And that's one of the things that I'm against prescribing at home. And that's one of our things for NeuPath Mind Wellness. We do you do the Yale protocol. It's in the clinic. You do your 6 sessions over 2 to 3 weeks. And if you need to come a couple times a year to do a follow-up, you do that. And then you do your integration and you do all that. I don't like replacing one drug with another drug or sending them home with more drugs. There's just,
preaching to the choir, man. I think you're kind of chasing the high, or you're not doing the work. You're kind of you're using these medicines to kind of, swing from like monkey bars. You got to stop and do the work, man.
We got to get out of the habit of the doctor said, just take this and everything will be okay.
Exactly. It's magic pill.
There's no magic pill.
It's called work. It's called work for a reason. So Doc and I met out at Camp Zappy. And so you had a great experience with ketamine. You're like, let me go, since the client did it or that kid did it. I, being a little bit of a medicine snob, I started with Ibogaine. Mm-hmm. Going straight to the top. That was my introduction to psychedelics, was Ibogaine and 5-MeO-DMT. So when I heard about ketamine, and first of all, people were like, "Oh yeah, if a veteran's suicidal, get him to do some ketamine." I'm like, that sounds like the dumbest thing I've ever heard. Somebody's suicidal and you want to get, I'm like,
I was of the same mind at first. I'm like, but it's a tranquilizer. It sounds like it's going to make you more depressed.
And I heard the words dissociative. Right. I'm like, I don't want to be disassociated. Right. I like me. So I was a little creeped out. And then I hear people like, oh, it's 6 treatments or whatever. I'm like, I'm comparing it to Ibogaine. I'm like, I was on my ass for 12 to 14 hours, man. I couldn't even move. Rolling on my side took an executive decision of all my strength. So I was ignorant. And then I'm like, you know what? Zappy called and he's like, hey, man. I'm like, you know what? It was perfect. It was perfect because from a clinic, if I can use that word, a clinical setting, I can't talk to it if I've never done it. And then also, whenever that was a couple months ago, I'm like, you know what? I was having some ice buildup on the wings, a little bit of rust buildup. I hadn't sat with the medicine or any medicines in a while. But the gift of these medicines is for me to be able to look out on my wings now and see that ice buildup. Old me, I would have fucking stalled and, I would have JFK Junior'd into the sound here. So went out there, met you, and it's so interesting because, I do all my research and now I treat these like a combat mission, man. I
love that. And I love listening to you talk on a podcast about it because as a civilian, we don't have that kind of reference to that frame of mind. And I've been self-employed my whole life, so I've never been in the corporate environment either. So to listen to you, how you break it down on the show, it's super cool.
Oh, I appreciate that. So it was so funny because even though I had read about it and it's like kind of short acting and stuff like that, still like when Zappy was like, all right, so, in about 45 minutes, we'll be able to I'm like, what? Like in 45 minutes.
For most people, yeah, 95% of people are fine an hour later.
Are you kidding me? I'm still like, I got my mouth guard in and my chin strap on, like ready to fight. And it was so cool. And so quick debrief, it absolutely is a psychedelic. It was to me.
You do get an experience and you can't have, visuals and the whole nine, the body feelings.
Yeah. I had some visuals, but the sense of calm and at least to me, my experience was God, whatever word you want to use, but I choose to use the word God, was like, you're good, man. I appreciate you checking in. You're on the right path, man. Everything's good to go. You're fucking fantastic type of thing. I'm like, all right. And then, 34. And I had to go clinical too, because we did the lozenge. We were going to do the there we go. Hold on. Intramuscular. But but the guy couldn't make it, right?
Yep.
And then we did the lozenge, which you can
400 milligram.
You can break it down better than I can, but it was still an incredible experience. So, talk us through the ketamine activation, like how the difference between intramuscular, IV, and lozenge.
Right. So the obviously the dosages are going to be different. With the lozenge, right, we do about 400 milligrams, but you're maybe absorbing, between 60 to 100 milligrams, something like that.
Wow. Okay.
Yeah. So it's, and then the same thing, typically if you're doing IM or IV, it'll go by your body weight. You might end up doing like, depending on the clinic, there's different protocols. They might start you at like 0.5 per body per pound or per kilo, right? Or it'll go up to some clinics will do up to like 1.0 or more, right? So. Okay. It really depends. There isn't a standardized protocol. That's one of the things that makes this interesting and such a new field, right? Because it hasn't been rolled out where it's like, hey, everybody use this. And there are different clinics that will only do IM or only do IV. And then there's like we talked about the Spravato, which is the nasal spray, which is even insurance reimbursable. Personally, I don't like spraying things up my nose. I don't feel like that's a great method of administration. I don't know what that's doing in there. So I'd stay away from that. And that's not a medical advice. That's my personal preference. Yeah, absolutely. IM and IV, sometimes people don't like needles. So a lozenge might be better for them.
True. Okay.
Although the experience, and I have not done the IM or the IV yet, and we're going to be doing it soon at NeuPath. Over there, but from my understanding and from everybody I've spoken to, is the IM and the IV is actually a whole nother level of.
That's what they said out there. Charles, Patty, he's like, hey man, you need to come over to Tampa and do the IV type of thing. It's a quicker launch and blah blah blah. So I'm interested in that.
Yeah, I believe in Charles's clinic. I think they're doing IM, right? So you're getting the full dose at once, and then they might give you another dose like 20 or 30 minutes later, depending on how you're into it. Okay. IV is a little different, right? So with the IM, you're going to get the full dose. So once you go in, it's a little hard to control. If somebody, 95, 98, 99% of people are just fine. And I spoke to Charles there. He's never had an incident. They've never had a problem. They've never had to call any emergency services. They've been open for 4 years. They've done thousands of treatments.
Great track record.
Exactly. Not one incident. And same thing with most of the providers I know out here in South Florida. Never had any incidents, but just in case, and occasionally the main side effects, and we had somebody at the retreat out of the, 25 people that were there.
Yeah, one
person gets nausea, occasionally, or they might get a little sick or something like that. Typically, a lot of these places will give you some Zofran or something for, some anti-nausea medication, just in case, if you want it, if you need it. Some places do it, prophylactically, to just take it in advance, and some people just give it to you, be like, hold on for it if you need it. And with the IV, you can administer it. But with the IV, the nice thing is you can start very small doses
and step it up.
Yeah, exactly. Okay. So you can control it better. You can control how long they're under for, and you can give them the exact dosage. Okay. Which is the IM, once it's in there, is full blast. I mean, that's immediate. Yeah. And then with the lozenge, as you experience, you've got to swish that around in your mouth. Well, it depends. So the way we do it and the way Zapping the group likes to do is they like to have that done, swish it around for about 10 minutes and then spit it all out. And I know the first time I did it, I was like, oh my God, I can't even keep all this stuff in my mouth. Yeah, it's like the nastiest thing in the world. You get used to it. It gets real foamy.
It's like a cough drop tasty thing.
Exactly. And it's just like a bunch of foam in your mouth and you spit that out. But part of that is because they feel if you're swallowing it, then it hits metabolism even different than the sublingual, and it may last longer as well. So that part of that was specifically to control it. So it is 45 minutes to an hour of experience.
Got it. Okay.
Those are the 4 different main methods of administration: the intramuscular injections, the intravenous injections, and the lozenges and the nasal spray.
Right. Can you get a full liftoff with the nasal spray, or has it got to be like a shitload of? I'm not a nose up the. I can't do that
it depends on the dosage, and once again, I'm not. And I know some clinics are doing it, and some insurances are reimbursing for it, but
that's usually at home too, right? That's usually how.
So some people do it clinically, and some people do it at home, and then sometimes they'll have it at home where like there's a few different companies now where like you'll be on the phone with a therapist and they'll kind of talk you through the. Yeah, exactly. I always think doing the integration live and in person is always going to be better, and I always feel better if you're doing something, especially if you're not experienced, right? It's good to have a trip sitter.
Yeah.
Right. You never know if you do get sick or if there is some kind of complication. So like what we do at NeuPath, right? There's always a nurse practitioner in the house that's actually worked in emergency department. And we have EMTs on staff because they know how to deal with, any sort of, if there is some kind of psych issue or somebody has a breakdown or there is an emergency with its airways or something like that, which is never going to happen. It's extremely unlikely. And from all these clinics, I've never heard of an incident.
Correct.
But, I feel
it doesn't hurt.
Exactly. It's better to have and not need than need and not have, right? So safety first.
Okay. So ketamine, it was an incredible experience. I loved it. So it answered if somebody's suicidal, get them some ketamine. I'm like, that's the dumbest thing ever. Now I say that's the smartest thing ever. So the young kid that you talked about to some of these veterans, I can now use the words trauma stabilize to
I think the
triage was not trauma, triage. So it's a good, but I can also see how
it's quick, it's legal. We don't got to go to Mexico or anywhere else.
Yeah.
Right around the corner.
It's right here. And I can also see how it can be one and done. I can see if you did that Yale protocol. Now I get why people are like, oh, I did ketamine and I'm completely healed. I'm like, that didn't sound right to me. After doing it, I'm like, that could have been, if that was my only experience, not ibogaine and psilocybin and toad, that could have been pretty life-changing and healing.
It's significant. I think the 3 times I've done lozenges, I've had quite an interesting experience. I think, the last one, when we were together, I got an overwhelming sense of gratitude. I was just like, look at what is going on in the world. Yeah. And we're in Malibu, in the most beautiful place in the world.
Doesn't suck.
It was great. And I was just so happy. And the other thing, I think we talked about it briefly, is for me, being that it is an anesthetic, it relaxes the CNS, the central nervous system. True. So for me, I have, from all the martial arts and working on a computer before that, just, chronic, stiffness and tightness. And I just feel the spine just melt, which is one of those, one of the other things we haven't talked about is it's used for chronic pain too. So
True.
A lot of doctors, and the protocols are a little different, but like you said, knock the ice off the wings, right? Like every time you go through one of these experiences, personally, I feel like I've dropped 40 pounds of stress. Yeah, man. Like I walk out of there, just your head is held up higher, right? Yeah. You're breathing better, you're moving better, and it just kind of helps you reset. And some people may need a recap every now and then to dust some the rust off or the rust. And for some people, they might just be one and done. Mm-hmm. And the interesting thing and the nice thing about the ketamine, and I think as more of these things open up, I think we need options. Just like some medications don't work for some people, Correct. Whether it be antibiotics or any kind of medication. Correct. You might just not do well with psilocybin or iboga, but maybe ketamine's for you. Maybe LSD works for you, right? And we don't know. And we owe it to society to allow people to try what works for them. Yeah. Well, at least give them the buffet. Hey, here's the range of options, man. Iboga or an ibogaine or a psilocybin or an LSD or a ketamine. Now let's talk through, because, talking about the psilocybin to me, and it was cool. So ketamine, 100% legal. Schedule 3, right? So prescription pad. Hanging out with Rick Doblin. Rick's like, hey, man, we targeted MDMA first because that was the last one that they clipped, 1985. Everything else is going to be a little bit of a longer slog. So hand to God, hopefully August 11th, FDA says we're going to reschedule this, man. Yay. And it's off to the races. Up next should be psilocybin. So talk to us through about your psilocybin advocacy and how far out on a timeline do you think we are? Is it that close behind MDMA or are we stuck in lag? So we're estimating, they haven't set an official date yet, but we're estimating 2025 because we're not too far behind. And there's 2 different companies that have already finished phase 3 clinical trials and some that are in phase 3 clinical trials. Okay. So that's very positive news, right? Yeah. And phase 1 and phase 2 clinical trials passed with overwhelming success as well. We're still talking about these 60 to 70% success rates, perfect safety record. And the FDA gave them, a lot of them, breakthrough therapy designation, which is, if you know what FDA breakthrough designation means, it means, so Uncle Sam has 2 inboxes, like, put it here, we'll get to it when we get to it, or, hey, put it here and let's talk. Let me help you with shit so we can, really get this thing going. So it's not in the shitty inbox, it's in the good. Like the FDA saying, we got some,
this is looking tight, and let's tighten it up a little bit.
Well, we need it. I mean, we have this whole mental health crisis, right? I mean, I know you're a big advocate for all the veterans, and God bless you guys, and thank you for the service and all that. And you guys should be first in line for any of that kind of stuff. And, we saw with everything that happened with the pandemic, right? That, mental health for everything from kids to adults, everybody else, it just further isolated people, further segregated people, further divided people on political lines, everything else. Yeah. And we just have, the crisis is exploding. And we see that we know that the prisons and everything are full of people that a lot of them is just a mental health issue. Right. It's not necessarily a criminal issue. It's just they're not getting the proper care, and the police and fire and EMS don't know how to deal with them either. They're just not trained for that.
Correct.
Everybody's kind of thrown in the same basket, and then they end up, when a lot of this stuff is preventable, just like with diet and everything else can prevent, heart attacks and obesity and everything else. Same thing with mental health. So I think it's one of these things we need to explore. So personally, on the psilocybin, I got involved on advocacy for it a few years ago, just for the need for my patients. And then two, there was a doctor by the name of Sunil Agarwal that started the AIMS appeal. And basically there's the right to try laws. There are these federal laws that exist that say basically if you are at end of life, right? So if you have cancer or if you're terminally ill, you are legally allowed, and federally and state laws that already exist for this, that say you're allowed to have access to any medication, an investigational drug, if it's already passed phase 1 clinical trials, and if it's been proven to be safe and effective, you are legally allowed access. So now psilocybin, like we talked about, is already going into phase 3 clinical trials. There's some that are completed. Yeah. The DEA is still refusing patients access, even though, they're circumventing the law at this point. The DEA is acting illegally. So this Dr. Sunil Agarwal put in an appeal. The first one failed. The second one failed. And then we got together with a bunch of different attorneys and a bunch of different doctors, and basically appealed the DEA. And we went and we sued them, right, and petitioned them in the 9th District Court, which is one level below the Supreme Court.
Sure.
We won the case, right? So now that we won, though, all that says, is now they have to come up with a reason why they're denying it. Because the last couple of times appeal went in, they basically just said kind of no comment. And that's it. And they got away.
DEA, man.
That's it.
That works for us.
With our tax dollars that we pay for, is preventing people that are terminally ill access to drugs that may help them with their end-of-life anxiety and depression. Now, I don't know about you, but if your mother or grandmother or my aunt or best friend
at the end of the rope, man,
was dying, and if this could give them any relief at all, and we know it's not harming them at all, and they're going anyway, why?
It makes me furious, bro. It's almost like the DEA. So the DEA also decides religions in this country, apparently.
Correct.
Because there are folks out there. My brother Justin Lepre runs Heroic Path to Light in Texas. He's like, we're an entheogenic church. And the DEA is like, well, no, you have to apply to us. I'm like, whoa, where in this copy of the Constitution does it say the DEA, gets to decide what my religion is? We got fucking Scientologists floating around out here, man, and you're not going to let me practice. I've never been more spiritual in my life after my medicine experience. 100%. I lost my faith, man, after my sister died and military trauma. I'm like, there ain't no fucking God. Holy crap, there is. And I was disconnected. So you're going to tell me I can't practice? I can't connect?
Freedom of religion, right? I believe it's somewhere in one of those.
Maybe towards the back. But I can believe the DEA. Dude, it's a jobs program. They're seeing the writing on the wall. They know all this stuff is coming. How can you, they define a Schedule 1 drug as no therapeutic use and a high risk of addiction, which is the definition of a cigarette and alcohol.
Which psilocybin and even cannabis somehow is still on there, which is ridiculous because we have, especially, you look at cannabis, we got, thousands and thousands of clinical trials going back, 100 plus years. Correct. That are proving it's safe and effective, and we're still there.
Well, you look at the chart of, what is it, the harm reduction scale or whatever, it's alcohol, coke, heroin,
all the legal stuff,
tobacco, and then over here on the right side is psilocybin,
correct. So right now, cannabis and LSD and psilocybin is considered more dangerous than fentanyl.
Oh my God.
Fentanyl is on a lower schedule, right?
Yeah.
That has medicinal use.
Yeah. And so, and getting back to my brother, Dr. Martin Polanco in the New York Times yesterday, the reason the New York Times had this big article on ibogaine yesterday was the opioid crisis. Man, 8 months after ibogaine, I still couldn't even look at alcohol. If I looked at a bottle or a drink, it made me, I dry heave a little bit. I'm like, oh my God. And I was a drinker. So the fact that heroin addicts, read this article in the New York Times, folks, I should post it somewhere on my website, about 85% of heroin addicts, people that are just, in it, up to 3 years after one ibogaine treatment, don't even use again, ever. And that's illegal. I can't. How do you even function?
It's beyond insane. And I lost my brother to the opioid crisis, and some of my close friends, and like I said, probably 30 plus people that I went to high school with that are no longer with us. Obviously, here in South Florida, we're ground zero for all that.
Yeah.
So we've seen it, we've watched it, and being in acupuncture and pain management, I'm dealing with patients that are coming in and they've had scripts from their doctors, and they're willing to do anything. And it's just, I think everybody probably knows somebody that's been affected from addiction, right?
Yeah.
And
or even not just addiction, mental health issues. Totally. Everybody knows somebody, if not you, right?
So once you're at least in 20s, 30s, like you're gonna, it's around. It's around. It's not one of these things that we can kind of sweep under the closet like we've done for all these years. We see what's going on in the data and the iboga. It's just insane. We're losing lives. There's over 100 Americans die every single day from overdose, from opioid overdoses.
Opioids, yeah.
Over 100 a day. It's one of the leading causes of death. And if we have some kind of medicine that can possibly help prevent that, it is irresponsible and once again, unethical and immoral that anybody should get in the way of that progress.
Correct. Well, and you all can figure out why it's illegal. When I go to DC and I talk to the congressman, and behind closed doors, of course, they're like, "Oh, Whiz is great. We love what you're doing." You're gonna have a problem with the big pharma and the alcohol and tobacco lobby. I'm like, I'm gonna have a problem. How about you, man? Lead, follow, or get out of the way. So we gotta lead. This is I keep saying this is a we the people moment. This is pitchforks and torches. They're not gonna lead. We're gonna have to lead from behind.
The revolution's got to start at the bottom, right? Grassroots movement.
That's exactly right.
Speaking of the opioid crisis and mental health crisis, do you know who made the SSRI drugs so popular that we know no longer work? They just came out with a study about a year ago that they said the 50 years of data and research on the SSRIs, like Lexapro and all that, the whole theory of how they worked was completely wrong.
I saw that.
The whole serotonin uptake blockers, they were like, whoops. From the very beginning, it was just completely wrong.
God, no.
It never worked how we thought it would. It does work for some people. There is a small percentage of people that do get relief from some of those medications. However, the side effects are brutal on a lot of them, and a lot of people get no relief from them at all. But do you know who made those popular? Who brought those to market? The Sackler family. The Sackler family is the same company that brought us the opioid crisis.
Oh, yeah. Duh.
Right? So
I saw that.
It was
Netflix.
like the grandfather. Yeah. So exactly. So that same family is basically responsible for what's going on with the mental health crisis, as well as the opioid crisis, which are just kind of intertwined. And we're still suffering and cleaning up their messes.
It feels like we really are in the age. It's the age of Aquarius. We're on the precipice. I keep telling people, I have a chart with 2 lines. This is the world in the United States. We are in a nosedive, man. And here's the rise of everything that you and I are talking about. Again, a medicine woman in the Amazon or a medicine man in Gabon would be laughing at us like, yeah, welcome to the party. You're a little late, but it's better late than never. Talk to us about how, well, first of all, you're opening. Tell me about the place in Delray. You're going to be open, especially for all our local folks.
Absolutely. NeuPath Mind Wellness is going to be a ketamine infusion, functional medicine, and integration center. It's a 4,200 facility.
It's going to be one stop.
Exactly. What we've seen is a lot of these clinics, what happens is you go in, you get your treatment, and it's like they kick you in the butt and see you later, right? Yeah. And as we know, that's not enough. You need to do the work, like we've been talking about. You got to do the integration. And part of the problem is
otherwise it was just an experience. And if you don't integrate, it could turn into a negative experience.
Bingo, right? Because in that phase after you've done a psychedelic, right, you have that time frame where you're going to have the neuroplasticity is going to be going off. So that's when you have to reprogram and you get out of that default mode network and get out of your negative habits. And that's your chance to break out of your bad habits and program some new positive habits. So we're committed to making people do the work, right? And also not fooling them that, this magic drug is going to fix every problem you've had. Like this is your opportunity to do the work, and we're going to help you.
You got to do the work.
Right. And we're going to guide you, and we're going to help you, and we're going to, make it as comfortable for you as possible, but you got to step out of your comfort zone a little bit and get your hands dirty. Right.
I love you said that, because 2022, I forget which year. That was a tough year for me with the foundation, trying to help vets and first responders and their families. I felt like I was failing, because we'd give some healing grants and people, I'm like, wait, I'm failing. And man, I went to Costa Rica and I did Iboga for the first time, the actual root. And again, use whatever word you want to use, but it was God to me. God came to me and he said, hey, son, I appreciate it, but you can't heal anybody. They have to heal themselves. Right. And me. He's like, keep doing what you're doing. Get them to the door.
You lead the horse to the water, right?
Yeah, they got to walk through, Matthew. And I was like, I felt so much relief, because I felt like a failure. I'm trying to help people.
Well, I think when you're used to being a high performer and success driven, right, and you have like your mission, and you're like, if I haven't completed my mission, you're still watching all these people suffer around you.
Correct.
And it's difficult. And as a clinician, that's one of the most difficult things for us to realize is you can't save everybody. Yeah. But you're going to do your best, and you're going to have some successes and you're going to have some failures, and you have to learn to not take that home with you and just thank God every day and be grateful for the opportunity to be of service to others.
Correct.
What they do with that.
You told me this 2 years ago, man. Where were you?
And then part of it, I think I relate a lot of this back to the Eastern medicine thing. And, we were talking about, the country's in a nosedive, society and all this and that, but I think it's always yin and yang, right? And, there's a positive, there's a negative, there's day, there's night, there's good, there's evil. And the truth is it's pretty balanced, and each one of us gets to choose which side we want to be a little heavier on, right? So you can choose to be like, life sucks and be all depressed. And I'm not saying it's a choice for everybody, because, depression, anxiety is a real thing. Yeah. It exists. Yep. But our mindset and our actions and us doing the work is going to make a big difference along that. And it's going to help lift up those around us, right? If we're hanging out with a bunch of people that do nothing but complain there all day long, then that's not going to be good for anybody, right? Yeah. So with NeuPath, what we're going to have, we have 1,000 square foot event space built in there, where we're going to be doing yoga classes and Tai Chi classes and group retreats and events and things like that. So we have 7 or 8 different treatment rooms where you'll be able to do ketamine infusions, proper, the right way, under the right dosages. We'll be referring out everybody to make sure they're doing, some psychotherapy, some ketamine assisted therapy. We're going to be working with providers to refer out to therapy. We're not doing the therapy in-house, but we're going to recommend that every single person do the therapy. But our goal is to basically have therapists referring with us, so that we're not stepping on their toes, worried about them like taking the business from them.
Yeah.
Right. So, but we're going to have the group events. We'll have cooking classes. We'll have breath work classes. We'll have, the sound healings. All that stuff is going to be live on site.
Holotropic breath work.
Bingo. Lots of different styles of breath work, right? Everything from, Wim Hof to holotropic and therefore, and they're on and they're on. But the nice thing is also the community aspect. There's a lot of people that are suffering, whether it be PTSD or depression. It's if you go to this very clinical setting and then they put you in this room all by yourself. Yeah. And then you get this infusion,
lab
this
coats
great experience. And then it's like, see you later. Yeah. And, ring up your card. And that's not what we're looking for. So we're looking for more of the membership model, where you're going to come and you're going to meet other people in the community, and you're going to spend time, and you're going to do some yoga with them or some qigong with them, and sit through a group session if you want, right? Yeah. Then we'll have some anti-aging stuff in there too. Some longevity stuff, which will also help with mental health, everything from red light therapy to, the vibroacoustic beds and maybe hydrogen oxygen therapy, stuff like that that will also help reset your brain and reset your hormones. And a lot of this mental health issues, a lot of it is things like neural inflammation, right? Or even digestive issues that are affecting your serotonin levels.
Correct.
and all these other things. So we're going to focus on the integration and the functional medicine and having access to all that, so we can work with you on your diet. We can work with you on getting your labs drawn to see, hey, do you have a vitamin D deficiency or a B12 deficiency?
Thyroid problem.
Exactly. Yeah. So all thyroid problem, huge cause of mental health issues, right?
I have Hashimoto's. I had to treat my thyroid and stuff like that. Yeah.
Bingo.
Helps change everything about me once I figured out my thyroid was messed up.
And when it comes to thyroid, even when you're doing conventional treatments, a lot of times they're subclinical. So like in a case like mine, when I was going through all my stuff, it ended up that I was having all these different thyroid-like symptoms, but all my thyroid labs were 100% perfect. And they even did biopsies of my nodules and everything, which is not a fun procedure. They're sticking 4-inch needles in your neck and digging around in there, and they made me do it twice. And they told me it was perfect, right? But I had all the symptoms. I had all the signs.
Yeah.
So that's one of the things that we do on the functional medicine side, is kind of dig real deep and see, hey, do you have some kind of microbiome issue? Do you have some kind of other endocrinological issue, right? Is it your adrenals, your cortisol levels? You know, all these things often work together. And if you don't have this perfect balance, you know, and look at every body system, not just
holistically.
Mental health is not just your brain, right? Your brain is not separate from your heart or your lungs or your kidneys.
Mind, body, soul.
Bingo.
Yeah, all in alignment. I love the fact that you talked about community. It's really interesting, just like the Netflix 9 Perfect Strangers. You can go and do this stuff or go on a medicine retreat, and the first day you can see everybody's kind of like, you know, and by the time everybody leaves, everybody's hugging and they're best friends. Right. When I went and did Ibogaine with, you know, Marcus Luttrell and JT and a bunch of other guys, I'm like, all right. And by the time we left Monday morning, man, we were best friends. We're still best friends, right? Years later.
It changes everything.
There's something about a shared experience that's also, as people are working through their shit, man. And it's courage. It takes some courage to show up, to be vulnerable, and to want to put the mask on yourself first, because you ain't good to anybody else.
A lot of this isn't talked about. I like that you brought up the shared experiences, and that's one of the things we're going to be doing for multiple reasons. One, for reasons like that, to have the community experience. Yeah. Two, sometimes it just takes people out of that very sterile clinical, like I'm in the room by myself. It's kind of like free. If you have anxiety and somebody throws you in a room by yourself with an IV in your arm, right? That might not be the best thing for you, right? Two, it'll make it more cost effective for people than having like a private session. So for people who are maybe can't afford to do, you know, the whole clinical thing, they might be able to do an event, and they get the benefits of having that whole experience with it, where we're doing the breath work and the Tai Chi and like all that other, you know, a good meal afterwards, all that kind of stuff. That's awesome. You know, the sound healing. Yeah. So it enhances the experience. And these are other things that will also help, you know, just overall structural integration. But, you know, one of the things that's not talked about is our opening the heart, right? So opening the heart, and there's been some studies that show actually, you know, it's an electromagnetic waves that we emit, pulses from the heart, and our heartbeat and our electromagnetic frequencies do affect the people around us. Just like women, when they're together, their cycles end up linking up. And this is scientific fact, right? Yeah. Or just like when you lose a loved one or a spouse after so many times, that you can die from a broken heart. Correct. So I think a lot of that is still needs to be researched, and we don't quite understand how that communal aspect works. But then even though we're talking about things like ketamine or MDMA, we look at the communal aspect of how psychoactive substances have been used since the beginning of time, whether it was, you know, Blue Lotus in Egypt or Iboga or ayahuasca. Yeah. It was always a communal thing, right? Or psilocybin. It was, you know, you'd get out there, you'd play the drums, you would dance. Rite of passage. You would chant, you would, and that's the medicine. Yeah. That's the medicine, right? That just helps, you know, the medicine itself just helps kind of activate, tune you in faster. Yeah, I think it's just like a times 10 or times 100 or times 1,000. But you know, you can get this work. I don't know about you, but personally, I don't have 6 hours a day for meditation. Right. So I would love to. And they've done studies on these monks and, you know, Tibetan monks and Shaolin monks, and they see the changes in the brain waves. And they see that you can actually get some of those same experiences, and you could see those same brainwaves change from psychedelics or from breath work or from other practices. So I think it's just it's a shortcut, but it doesn't exclude you from doing the work. Doing the work. That's exactly right. Might be a helicopter up to the top of the mountain, but you still got to do the work. It's interesting because
the science is still trying to catch up to the anecdotal stuff, right? That's why I love the Ibogaine in the New York Times and all these companies doing all these phase whatever trials. I read about this in How to Change Your Mind. Great book by Michael Pollan. I didn't know this, that penicillin was discovered in, I guess, the 20s, saved a lot of lives in World War II and saved millions of people's lives. It wasn't until the 60s that they figured out the how. So it's interesting because, I talk anecdotally about my medicine experiences, and I really think it's a bridge. Like on one end of the bridge, it's veterans, it's first responders, it's family members, it's civilians having these pretty awesome experiences. And then you got the folks in the lab coats and the beakers like, I want to know the how and the why behind that. And I personally believe, I don't know if that bridge is supposed to be met. I think God's right in the middle of that thing.
I'm with you, and I really love that you brought that up. And if you look at the, depending who you ask on the definition of evidence-based medicine, obviously we want to use the best clinical science that we have.
Sure.
But there's also the expectations of the patient and the clinical experience of the doctor or physician, whoever is administering whatever kind of medicine it is. Yeah. And
their biases or their,
totally
all sorts of stuff.
And what I feel part of the disservice that we're doing is a lot of times these anecdotal things or case studies or things like that are kind of discounted as not being science-based or not being evidence-based. And that is contrary to what the scientific method actually is, right? Because this has been practiced on thousands, millions, maybe billions of people for thousands of years. That is the literal definition of the scientific method. We're redoing the same experiment.
There's your group.
Over and over and over again, just because there wasn't a randomized controlled clinical trial with a police.
Double-blind placebo.
It doesn't mean it doesn't work. It's just a different type of evidence. It's still scientific. It is the actual definition of the scientific method.
But we ignore it. Yeah.
And part of that, you wonder how much of that is propaganda and programming from the industry to keep people, I think it's just giving them time to catch up so they can start patenting their own.
That's exactly right.
Get their own trials going and
Well, you know me, man.
I medicalize it all.
I'm torn, right? I remember. I have to introduce you to Nicole, our director of medicine operations, because we were down at that like Benzinga psychedelic conference a couple of years ago. And I'm sitting there listening to all these presentations, like the guy from whatever small company. We're going to change the psilocybin molecule to this. And, so if you only have an hour between yoga and car line, you'll be able to do it. And I'm like, wow, this is fantastic. More, it'll be able to reach.
Is
more.
it?
Well, she kind of gave me a little kick under the table. She's like, this is awful. I'm like, oh, wait, what? She's like, especially for me, taking the psychedelic out of the psychedelic, these things have been used for thousands and thousands of years. And now we're sitting here with our beakers and lab coats, and I'm going to change this one molecule. And now it's called Ibogaine and it's $20,000 a month type of thing. So how do you feel about that? Because you're on both sides.
I am.
You can wear your flowing robe and you can wear your lab coat. Where are you?
Thank you for asking. That is a really good question. I think I'm also in the middle. For one, my formal education as an herbalist, I don't care about the mechanism of action or the molecule. I just want my patient to be better.
Result.
And if it works, and if I know it's worked for thousands of years and the clinical trials have already said it's safe, then it doesn't matter to me who's patented what. It doesn't matter to me if you're growing it or what. Now, obviously, on the other side, you want to make sure the stuff is clean. You want to make sure there's no mold or heavy metal contamination or possibly other drugs, which we've seen now. There's been some reports of like chocolates from the West Coast that are contaminated with other things.
And also culturally, if you don't know iboga, the plant takes 30 years to get to the point where it can be used for the medicine stuff. So people are like swooping into Gabon and the Central African Republic and
we have the same issue with peyote now, right? There's going to be a shortage, right? So I would advise people.
Or the desert Sonoran toad with 5-MeO DMT.
Correct. So personally, I think if you can leave the animals out of it, right? And especially with the DMT, we know the synthetic compound actually works. And you are having the experience. So I'm all for that. I'm all for safety. I'm all for protocols. I'm all for third-party testing on products to make sure they're clean and uncontaminated.
Correct.
Because you don't want somebody who's having an issue and trying to get better, and then they're taking something and there's rat poison in it or whatever it is. So I think there needs to be some regulation so it's not a black market, but as an herbalist, I find it hard to understand why you can grow tomatoes, which have anti-cancer properties, or lemons, and mint, which is medicinal, but you can't grow your own cannabis, or psilocybin, which is also medicinal. Like, I just don't. Yeah. I think there's going to be enough market for everybody. Is the real answer. You're going to have the people.
That's a good way to put it. Yeah.
You're going to have the people who are scared, who don't want to grow it. They don't want to be bothered because they just don't have time or don't have the expertise. Yeah. And you're going to have the ones that are like, I'm not buying anything on the black market. I want my doctor to prescribe it, and I want it to be clean.
I like the lab coat. I like the pharma.
And they deserve to get whatever they want.
Correct.
And they need to have those options. And then the people who are on the other end of things, and the problem I have with it is, like you brought it up, it becomes a $20,000 a month medication, right? Which is not. I mean, we're talking about, these are real numbers that insurances are paying for medications now, right?
True.
So if somebody doesn't have insurance, or if you're a senior citizen living on a fixed income, or if you just
veteran,
100%, right? If you just can't afford it, I don't think it's fair to say you don't deserve to have access to medicine.
Correct.
That is essentially free. That can be made for free. And, on the other side of things, I'm also for, like, if it ain't broke, don't fix it. Mm-hmm. I kind of subscribe to a lot of the Taoist mentality, is like, leave things as simple and as natural as possible. Like, you don't have to.
Don't make it complicated.
There's a Taoist saying from the Tao Te Ching, from Lao Tzu, which is probably the most read book in the world, other than maybe the Bible, right? It's like 3,000 plus years old. It says, governing a large country is like cooking a small fish. If you meddle too much, it'll be ruined.
Truth.
Right. So I think you can apply that to the medicine. Yeah. And if you want to meddle with it, go ahead, but you shouldn't deny us access to the, what God gave us.
So you and I are in a similar school. I'm torn. I'm right in the middle. It's great. And then there are drawbacks. But I want to remind people, folks, and Doc said this, healing's free. It's always been free. This world evolved with these things for us to heal. So it'll always be free. If you can't afford some, man, you can grow some mushrooms in your home office, in your yard, anywhere. Ayahuasca, peyote, the desert, all these things came from the planet. So again, especially as an investor, and I did my live trade brief this morning, teaching people how to buy the psychedelic names. I'm a little torn, but
I need the replay. I was on the way over.
Yeah, I'll hook you up. A Mind Med, Cybin. Atai. So Atai, I love Atai. So Christian Angermeyer is the CEO of Atai, and Peter Thiel, big Silicon guy, he's an investor in Atai. I like Atai, ATAI, because they're doing the ibogaine studies. Yeah. That's kind of near and dear to my heart. So MindMed, Atai, and I'm torn about Compass Pathways, CMPS.
So Compass is one of the ones that has passed the phase 3 clinical trials, right? And they're going to be applying for these.
I like that. So as an investor, I like that.
Right.
As Whiz, Mr. Medicine Man, they're kind of going around the medicine space, like trademarking and patenting everything. Like you want to use beige colors in your MDMA room. We came up with that. It's like, come on, dude.
That's ridiculous.
Yeah. So I'm a little torn with that.
And to be clear on what we just talked about, I'm not giving anybody medical advice here. This is just educational, and I'm not advocating for any sort of illegal use, but I do think people should have options, and they should do whatever's good for them. And this is your God-given right to these kinds of medicines.
You're the pilot in command of your aircraft. Right. You signed for your jet. I signed for my jet. So same thing. And I tell people all the time, I'm clearly not a doctor. I'm a political science major from South Jersey. I'm just sharing my experiences.
Totally.
There are so many potential ways to heal. God, after my dark nights of the soul and lying on a bathroom floor, I found, somebody was like, dude, you need to go do yoga. I'm like, I would kick my own ass if I saw me doing yoga. I'd take my lunch money, walk down the street to yoga joint in Fort Lauderdale, found yoga, hot yoga, and it started saving my life. That led to breath work. And then that led to the medicine. So there are so many different modalities to heal, man. What Doc and I talked about today is one of them, but climb a mountain in Nepal, man.
Done that.
There you go. Yeah. So clearly there are so many different potential healing modalities, but I like to remind people, especially, for our veterans or first responders, radical trauma might need some radical healing. And I'm not saying these medicines are necessarily, quote, radical, but
keep an open mind.
Based on what Uncle Sam did to us a long time ago, even me, I'm in the space. And when I use the word psychedelic, sometimes I am like, ugh. And I'm like, wait, dude, you're in the space. And it's still last week with the Mind Med good news on LSD. I'm like, I still had a little bit of a twinge of.
We've been programmed, right? It's in the media.
Yeah, man. Yeah. And again, real quick, the history of this stuff in the 60s, hey, here's a weapon. Go kill the yellow man on the other side of the world. I'm not going to do that. I love that guy. Why are you loving that guy? Well, I took these things. Well, those are illegal now. And here's your rifle. So we've been programmed and it's sad because this guy, because I had Rachel Newer, she wrote the book, I Feel Love, the Bible on MDMA. And the guy, the unelected bureaucrat in the Reagan administration that with a stroke of a pen did the whole MDMA thing. His widow has said the day he died, he regretted doing that, making MDMA and doing that. So back to my long rambling point here is healing's free, folks. Whether it's meditation, breathwork, climbing a mountain in Nepal, or potentially psilocybin or iboga, these things are available to you again.
And they're safe.
And they're safe, man. You can email me, Whiz at No Fallen Heroes, and I'll send you the chart of here's tobacco, cocaine, heroin, and alcohol versus the medicines.
So back to ketamine real quickly, right? It's been used and FDA approved since the 60s.
Wasn't it a child anesthesia?
In 1970, it was approved for anesthesia for pediatric use for children. So they use it to put children out, and it's safer than other anesthetics, which is why it's so commonly used, because you come out and it's a quicker recovery and it's less side effects and less risk than some of the other anesthetics.
You don't feel like you got hit by a truck.
Exactly. And it's and now we're talking about anesthesia. Once again, it's 10 to 15 times the dose that's used for these mental health type of treatments. Yeah. And that's why nobody's ever died from it, right?
Oh my gosh, man. Unbelievable. So when can we expect to go head up to Delray and hang out at your place, man? What's the plan?
Yeah, so NeuPath Mind Wellness is opening. Our grand opening, we're scheduled right now for May 4th. So,
no kidding. Awesome.
Yeah, so Star Wars Day.
Did you do that on purpose?
It worked out best for us. And actually, after we had picked a day between all the partners and the medical director, who's my brother, and everybody else, we just we came up with that, and then I went and reminded everybody. I said, "Hey, just so you guys know, it's Star Wars Day, so maybe we'll do a themed."
I love it, man! I'd do it because I'd love to come as Obi-Wan. I'll come in my flowing robes. That would be fantastic.
Perfect. So Delray Beach, NeuPath Mind. If you look up at NeuPath Mind, it's NeuPathMind, and that's the website as well. So NeuPathMind.com. I'm going to be up there, Doc. Thank you for putting down the ladder to help our veterans too. They're going to give a nice discount to our veterans and 100%. Our first responders and all the military dependents, which is great. Yep. LEO, first responders, anybody at EMT, veterans, whatever we can do, we're here to support. We want you guys to get better, and we want you to keep protecting us and serving the community. So
I appreciate that.
It's our little way to give back whatever we can, and we'll continue to support what you're doing with No Fallen Heroes and everything else you're doing with the Afterburner Afterburner podcast.
Yeah, man. I appreciate Doc. Thanks for coming in, man. It's a treat. I look forward to working with you to help save and change lives, man. There's no more higher purpose or calling than helping your fellow woman and helping your fellow man. So yes, great seeing you, man. We got to get Zappy on here. We'll shoot him a text after we leave here. So check it out, folks. NeuPath Mind up in Delray. Check out what's your Instagram again, Dr.
At Jonathan M. Fields. So it's JONATHAN, M as in Matthew, Fields, FIELDS.
Jonathan Fields, man. He's a great human being, does good work, and I'm just honored to call you a friend.
I appreciate that, and vice versa.
Yeah. Awesome. Hey, make sure you check out the replay. I think it's go.topgunoptions.com/healing replay, because I did give a brief this morning talking about the psychedelic names. Again, I'm not just talking about making money. I'm talking about potentially making some money as you're helping save and change.
Impact investing.
That's the word. That's right. It's impact investing or something capitalism, feel good capitalism. Right. Instead of just doing it just to make some money, you're doing some money. I mean, got to pay the mortgage, and I got kids in college, but after that, man, you're not a pharaoh. You can't take it with you. They ain't putting it in your casket, man. So at least, and I'm not one to quote scripture too often, but it'll be easier to for a camel to pass through the eye of the needle than a rich man to enter the kingdom of heaven. So make a little bit of money, throw it over the fence to help save and change lives. All right. Thanks again, Doc. Everybody else, have a great rest of your day. Happy hunting. Make sure you hedge. Fights on. Namaste. And Basi Basi. Whiz and Dr. J out.